Okay. All right. Good morning, everybody. And thank you for coming to the public discussion and reveal of the Lenz-Vig COVID Crisis Management Plan. I'm Dr. Shelley Lenz, and I am a veterinarian and small business owner from Western North Dakota, and your candidate, your Dem-MPL candidate for governor of North Dakota. With us today also is my Lieutenant Governor, Lenz-Vig. And it's my pleasure to introduce Ben as my Lieutenant Governor candidate, a fifth-generation farmer and former state legislature. Without further ado, I will get started on the slide session. So, Melissa, if you would like to start sharing that, and let me just get arranged here. Okay. In consultation with internationally recognized epidemiologists, medical professionals, and dozens of community members from across North Dakota, this plan was created to lead North Dakota through this public health and economic crisis. North Dakota's spirit of individualism is only matched by its history and culture of helping our neighbors, pitching in during times of need, and making sacrifices for the greater good. This plan is the result of conversations of that collaborative spirit of North Dakotans. This crisis is unprecedented in our recent history. COVID-19 does not discriminate. It is not political, and the response must not be political. Our response must be driven by data from reliable, neutral sources and must evolve as new information emerges. We must acknowledge that COVID-19 is a threatening infectious disease that very little is known about at this time, including its severity and long-term effects. Likewise, we must recognize that we are learning more every day about how to address the crisis and must identify information sources that are reliable, unbiased, and constantly evolving to guide our response. The core values that drove the development of this plan are the proposed structures are as follows: decisive action, collaboration with key leaders, clear communication, transparency, alongside guidance and education with the public are essential for making the plan and structure work. Recognition that we cannot effectively restore economic resilience until the virus is under control. Loss of life and long-term damage to the health and well-being of North Dakotans, including generational impacts, is too high of a price to pay for short-term economic recovery. Partisan politics should not be a factor in decision-making related to addressing the crisis, and following the best science coupled with knowledge. Every indication shows that North Dakota is a hotspot for COVID-19 and has seen significant increases in cases across the state. Although this is a global crisis, the harm is local, personal, and economic. The ongoing pandemic has no clear end in sight. In the absence of a clearly articulated, well-managed, and collaborative crisis management plan, the state will continue to suffer and be left behind. North Dakotans deserve a clear action plan that addresses the reality of the pandemic and its effect on our economy, our way of life, and our health. Addressing any crisis demands decisive leadership that puts in place clear lines of authority and communications to minimize confusion and to provide benchmarks for making progress. Other states and nations have learned that even with the most proactive strategies for containment in place, containment of the virus can take months to achieve. This makes implementation of the Lenz-Vig Crisis Management Plan even more urgent in that, as predicted, with an uncontrolled virus, it is now exponentially spreading in our state, and winter is coming. What does that mean? Colder weather means less outside events and more pressure for inside socialization. Onset of flu season, complicating the clinical picture. Decreased sun results in lower vitamin D levels, which will lower immunity and other health effects. Extreme weather conditions may limit accessibility to care, testing, access to labs. Decreased light brings on seasonal depression, complicating our mental health crisis. Couple that with budget cuts to health and human services, there will be increased diseases of despair, which will tragically lead to the all-cause mortality impacts of uncontrolled COVID-19. North Dakota is indeed in distress, and current management is clearly not getting the job done of protecting our health nor our economy, with generational impacts. The Lenz-Vig COVID Crisis Management Plan intends to outline a proper structure and operational plan for the state of North Dakota. Cooperative leadership from the state of North Dakota, our tribal nations, and fellow governors from across the region will be imperative for effective pandemic management. Otherwise, non-containment anywhere within our nation can undo even the most effective control efforts by states, counties, cities, tribes, and territories. And the virus will always find your weakest link. 3 key points you will see from this plan. It makes clear that we need decisive leadership. Nothing related to this can be political. And 3, we need a leader who will put our economy, our way of life, and our health at the forefront. Next slide. The Lenz-Vig plan emphasizes unity of response. The plan has clearly separate political and non-political roles. The Lenz-Vig plan is based on the incident command structure. This is a standard best practice for crisis management. This is not a new structure. It's just not being implemented. An incident command structure is familiar to anyone who has been a part of a coordinated crisis response, whether it's the floods, fires, tornadoes, military, bioterrorism, pandemics, or being a part of an emergency response team. An incident command structure provides a single point of contact where each individual participating in the operation reports to only one supervisor. This eliminates the potential for individuals to receive conflicting instructions from a variety of supervisors and political influence. Lines of communication are clear with shared terminology, shared goals and objectives, and thus are able to respond quickly. Each management position in the chain of command has a responsibility for 3 to 7 people, with 5 being ideal, which eliminates the potential for overload. This emphasis of 3 to 7 people increases accountability, prevents freelancing, improves information flow, helps coordination, and enhances safety. It results in efficient responses. All investments are done wisely with coordinated efforts without duplication of services and activities or ineffective use of public monies. Next slide. Elected officials will have a clear role to ensure equal branches of government are respected. The North Dakota executive leaders, including the governor and lieutenant governor and the leaders of the 5 nations, will work together to develop a shared understanding and articulate a shared vision for the implementation of the Lenz-Vig plan within the borders of North Dakota. It is the responsibility of each executive leadership role to facilitate the response plans and communicate high-level goals to their constituents, the general public, and the executive branch of other states and tribes. In that partnership, where there is competence, we join. Where there is no competence, we organize competence. With the Lenz-Vig COVID plan, and specifically with a veterinarian scientist trained in complex problem solving and crisis management at the helm, this will be an effective team. The executive branch will work collaboratively with the legislative assembly, a co-equal branch of government, to engage its legislative management process and thereby provide the fiscal and statutory means to facilitate the plan. A state of an emergency legislative session would be called to order to implement the Lenz-Vig plan. Next slide. A key component is to establish a COVID incident commander. This person works collaboratively with the executive, legislative, and tribal leadership and the Department of Health, has overall responsibility for Lenz-Vig plan implementation, operations, central communications, and establishment of ongoing goals and objectives. Importantly, he or she manages all other units of non-elected officials that are independent of the governor and tribal leaders in the legislature. He or she engages with an independent expert operations research to determine the best practices to increase overall effectiveness of strategy. The incident commander is usually medically trained, project management trained, and often military trained. He or she would be a colonel type operator with biological experience, but they also need flexibility rather than rigidity. From what I could tell, Dr. Stahl had the right qualifications and professional ethics, but the structure it appears the governor had in place prevented Dr. Stahl from executing the job without political pressure. To be clear, it is the incident commander that determines the best practices of public mask wearing, whether it is a mandate, which has been shown to work in other rural states, or a $1.8 million public service announcements, which thus far has been ineffective in North Dakota in the last 5 months. It is the incident commander who determines what is the best strategy, balancing science with available resources and with our North Dakota culture of individualism and commitment to community. That is the job of the incident commander, not an elected official. Next slide, please. The incident commander manages non-elected officials in 4 different sections. The key is that there is a direct communication and unity of command for each section. Those sections being operations, planning, logistics, finance, and administration. The governor has said that health officials shouldn't necessarily be making decisions that affect the entire state because they don't consider non-medical factors like economic, financial, legal, and political risks. I disagree. But to ensure a comprehensive view of the entire scope, it is the incident commander will be the one who takes all of those factors into consideration to determine the best practices to the executive and legislative branches to offer their expert guidance. For example, the incident commander would be the one who decides whether it's better to spend 1.8 million of taxpayers' monies on a personal or on a PSA, or whether to issue a mask mandate. That is what an incident commander does. This plan takes the political self-interest of the governor out of the equation and ensures our leaders are doing what is best for the health and economic situation of our state. Next slide, please. We will establish clear and transparent goals and benchmarks to address the virus. Number 1, implement robust and reliable testing, with particular eye on developing partnerships and relationships for the new generation tests, which are rapid, home-based, and cheaper, based on North Dakota needs. And it will be very transparent in those public-private partnerships and how they were chosen. We will provide clear and consistent guidance on best practices to reduce the spread of the virus. This is the whole point of an incident commander, separate from elected officials. Public mass use, again, has emerged as one of the key and inexpensive tools for virus transmission. It would be the incident commander who would offer the best strategy to make public mask wearing a reality. Again, increased spending on a PSA or a mandate. Working with surrounding state governments to reduce interstate transmission and increase purchasing power. Working with other states is particularly important for a rural state like North Dakota and putting us in an advantageous position for control of a virus and increasing our purchase power with public-private partnerships. And again, in working with other states, Where there is competence, we join. Where there is not, we organize competence. And that is how you bring order to chaos. Improving plans as new information on the pandemic becomes available, and borrowing the best practices from states with successful COVID-19 response are tailored to North Dakota environment and similar environments. For example, a low population state like Vermont is green, but a low population state right now, North Dakota, is red. What are the differences there? Or you could go with more geographically similar, like Manitoba, which is doing something right. This will lead to actionable decisions based on knowledge and best practices. Next slide, please. As a business owner employing working families with independent sensibilities like many of you, this plan recognizes the need for local knowledge to work side by side with state, national, and international governments. The Lenz-Vig plan is based on partnerships and not every state and local government being set adrift without the resources and guidance to fight a foreign invader that is literally killing and disabling us. Our North Dakota spirit of individualism is as deep as our sense of community. There is a time for rugged individualism, and there is a time for joining forces. The time has come to appeal to the better angels of our nature by helping our neighborhood, our neighbors, our communities, and our nation. This pandemic has exposed the fragilities that many of us in North Dakota were already very aware of. Fixing COVID addresses those fragilities and can help strengthen us and stabilize our communities. But remember, we have two crises going on at the same time: the health crises and the economic crises with generational impacts. They are interrelated. And so to handle the economic crisis so that we can handle the health crisis, next slide, please. We will prioritize and recommend to our legislature policies which will slow the virus and speed up stable economic recovery and stabilize our communities. To help ease the economic impact of viral control we will prioritize 5 policies which will also ease the economic anxieties of our working families, businesses are facing. We will enable schools and businesses to provide a COVID-19 safe environment with the proper resources and potential state monies to add to their infrastructure. We will implement paid medical and family leave. This will help with childcare issues and choosing between health and job, and will add stability to employers, employees, and schools. We will recommend and prioritize extension of unemployment insurance benefits within our state. We will recommend and prioritize North Dakota Care for All North Dakotans initiative, which is a public-private partnership that increases access of all North Dakota residents to affordable North Dakota private health insurance by establishing health insurance co-op buying group. And lastly, we will invest more and bolster in the Department of Health and the Department of Human Services, including public health, and initiatives like telehealth, peer mentorship, advocacy, public health, again, freedom from recovery, all those things that we need on the ground level to deal with this crisis. Some of these policy recommendations are part of the Lenz-Vig platform of homegrown prosperity. We already knew the fragility of our economic and health system. COVID just unveiled it in a dramatic, globally way. It is time for North Dakota government to invest in North Dakota and North Dakotans to defend us from outside forces, be that big banks, big business, floods, droughts, or viruses, like our forefathers and foremothers of the Nonpartisan League 100 years ago. It is time to get back to our roots of what made North Dakota resilient. Next slide, please. As a veterinarian, I deal with crisis management every day. I lead folks through some of their worst days of their lives where their hard decisions need to be made, balancing a loved one's suffering with financial constraints and unknown outcomes and the abject fear of making the wrong decision. Commitment to truth, clarity of realistic options, and a genuine concern for the well-being of all involved leads entire families and communities to make the best decisions for their loved ones and their communities. That's what I'm good at, and that's how I will lead North Dakota through the tough times that are here and the ones that are to come. Again, this plan provides 3 things we need to get out of this emergency, this crisis. It makes it clear that we need decisive leadership. Nothing related to this plan can be political. We need a leader who will, gosh darn it. Sorry. And third, we need a leader who will put our economy, our way of life, and our health at the forefront. This Lenz-Vig plan brings the order to the law and order. So our local governments and law enforcement units has the support and the resources to advocate for law and order in their jurisdiction to create a safe environment. And with that, I am happy to entertain any questions.
I think that Jack Dura from the Bismarck Tribune has the first question.
Okay. Is there a question?
He's on the phone. I think that you have to unmute from your phone, Jack. Let's go ahead and move to Jacob, and I will message Jack separately.
Okay.
Hello, Doctor. You say that you're calling for your plan to not be political and whatnot, but at the same time, you want to bring in a special session, and you say that political pressure has already been applied to Governor Burgum's response. I guess I'm wondering, how do you avoid making things inherently political when you bring in legislative assembly in this plan?
So that is the clear delineation between the executive branch and the tribal nations and legislative branches that govern from the incident commander. So the incident commander is bringing forth the best strategies based on all the knowledge, scientific, local, economic, that he receives, and presenting that to the governor and the legislative session. So they're not under the influence of political or personal interests. So for example, you wouldn't want the governor being an incident commander during a flood. But you would want the governor and the legislative assembly to come up with the resources and a plan to help the incident commander in a flood. And how you respond, or a wildfire, since those are going on right now.
Jack, can you try hitting #6? I think that's how you can unmute on the phone. Okay, he's gonna chat the question to me. Go ahead, Jack.
Okay. He's typing it to you right now, Melissa?
Yep, so I'll just read it. It says, your plan seems to give a lot of decision authority to the incident commander. If elected, shouldn't you be the cop on the beat?
No. So that's the whole point. Again, like, you want the incident commander, if we just put this as like a flood or wildfire, you would want the incident commander with clear, quick lines of communication to respond quickly to best practices, knowing everything on the ground. I happen to be a veterinarian and a scientist, but I shouldn't be making those decisions because I need the economic input as well. And that's what comes from the incident commander. He or she is the one that is doing it. Being a cop is part of the units that the incident commander will be managing. I'm not a cop, I'm a governor. Well, hopefully to be governor. And there's a balance of power, right? So we must make sure our legislative representatives are part of that decision. That's how you run a state. But we're not cops.
And then a follow-up question from Jack as well. Where is the accountability of our elected leaders if potentially tough decisions are left to appointed officers?
Yeah, so if the incident commander, for example, said best practices will be to use the CARES money for increasing, for example, $66 million to increase CARES or childcare or access to healthcare, and your legislatures decided to not allow that, and they voted for $66 million to cap oil wells, my guess is those legislators are going to be voted out of office. That's the voters keep the elected officials accountable by whether they listen to the incident commander or not. The voters always need to keep their elected officials accountable.
Great, and it looks like Jacob has a follow-up question as well.
Doctor, leaving a lot of the decision-making up to the incident commander, at the same time, as governor, you'd have to be able to sell a lot of these decisions to the people. And at least statewide, there's a lot of reluctance towards certain elements of this plan, including recommending a mask mandate. How do you sell this kind of plan to the people of North Dakota?
Right. So I think the job of a governor is not to sell anything, but rather to clearly articulate the why and the how. And so that's what comes with clear lines of communication and using best practices. That's how you do it. So if we have a shared goal as the state of North Dakota, and this is what we figure out with the legislative branch, the governor's branch, the executive branch, and the tribal leaders, our shared goal is to control this virus, then we need to search what's the best practices for that. And that's how we lead the state together. So it's not selling, it's informing, and it's clear, using terminology that is shared.
And then another question from Jack. To be clear, under your plan, you would make no decisions as to the state's pandemic response.
There is a direct line of communication from the incident commander to myself and Lenz-Vig and to the legislatures and to the tribal nations. That is the direct, and then those co-equal branches of government are the ones that make the decision based on that. That's the partnership or that's the beauty of our government that the Constitution developed for us. We need co-equal branches of government to keep everybody accountable and make sure the people's voices are heard.
I'm not seeing any other questions, so we'll just do one last call for questions from anyone else on the phone or on the Zoom call. Great, not seeing any. I think that we can wrap it up, Dr. Shelley.
Yeah. So again, I want to thank you all for coming today. Keep up the good work. The fourth branch of government is always journalism. So thank you for attending, and be well.